Hi, guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I teach on things that we currently do in practice, I will always say that so there's no confusion. Now, before we get started with our questions for today, as you may have seen, our Black Friday sales are now live, and there are things ranging from $29.99 and up, right? I have everything discounted at this point. You can get the ebook, you can get the paperback book, you can get the bundles if it's like the book and the self-paced review course. The benefit of the self-paced review is it is typically $89.99 per month on a subscription basis, where you can get it today for $79 one-time fee and get to keep access to it. There are my question and analysis sessions. You can get a 1 hour session. Typically, these sessions are $279. It is as low as $99. If you are on the YouTube membership, you got the bundle fee and early access to that, where you can get three of those for a discounted price as well. The digital flashcards are on there for $59, and you get to keep access. The Q banks are on there, and you maintain access versus the monthly subscriptions. And if you just choose that you want to get all of these, if you want access to everything, to include the ebook, the self-paced review course, the question analysis session, the flashcards, the worksheets. So everything digital, you can get all of those for $697, and there are payment options available, and you'll get to maintain access. No monthly fees, just one flat rate. So I have tried to put these things in a fashion to help you guys, because I hear y'all, and I'm here to try to help you along the way. So hopefully this is your gift. For the holiday season, to choose you. No more excuses, no more postponing. It's time to shake it off. You didn't come this far to only come this far. So get the tools that you need and get back to it. But all right, you guys, let's get into our questions for today. Question number one: a 3-year-old child presents to your clinic with a 2-day history of ear pain, irritability, and a low grade fever. The child has a runny nose and a mild cough. On physical exam, you notice a red, bulging tympanic membrane. The child is otherwise healthy with no significant past medical history. Based on this presentation, what is the most likely diagnosis? Is it A, acute otitis media, B, otitis externa, C, an allergic rhinitis, or D, acute mastoiditis? Take a moment and tell me what you got in the comments. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is being asked of you. So here the stem of the question states, based on this presentation, what is the most likely diagnosis? And y'all know what I always say. If they're asking for a diagnosis, you need to run it back and look at the assessment findings. How are they presenting, right? So this is a 3-year-old. Parents have brought them in with a 2-day history of ear pain, irritability, a low-grade fever. Child has runny nose, mild cough, but you also know a red bulging tympanic membrane. Y'all, that red bulging tympanic membrane is classic for A, acute otitis media. And remember, otitis externa, as I tell y'all, if you get stuck, think about your medical terminology. Externa being the outside, media being middle. Tympanic membrane is in the middle, right? So you need to think, if we're talking about that tympanic membrane, it's most likely acute otitis media. Whereas with otitis externa, the most common symptom that they complain of is that tragal pain, because the tragus is on the external portion of the ear, right? All right, question number two. A 2-year-old child presents with a 2-day history of irritability, pulling at the right ear, and a low-grade fever. On physical exam, the tympanic membrane is erythematous, bulging, and immobile. The child is otherwise healthy. What is the most appropriate initial treatment for this child? Is it A, immediate referral to an ENT? Is it B, amoxicillin for 7 to 10 days? Is it C, an oral decongestant and antihistamines? Or D, watchful waiting for 48 to 72 hours before initiating antibiotics? Take a moment and tell me what you got. So the stem of the question here states, what is the most appropriate initial treatment for this child? So again, if they're asking for the treatment, then you need to run it back and see if they provided you with a diagnosis. In the event that they have not provided the diagnosis, you want to run it back and look at those assessment findings. So here, the diagnosis has not been provided. So based off of these assessment findings, it's similar to question number one, right? This patient has pulling at the ear, irritability, a low-grade fever, and that tympanic membrane is erythematous, red, bulging, immobile. So we're thinking acute otitis media, right? So you want to think about how do we treat and what is that first line therapy? So the best answer is B, amoxicillin for 7 to 10 days. Remember, I always tell you guys to think about the A's for the treatment for acute otitis media. All right. And lastly, question number three, a 35-year-old female with a history of recurrent upper respiratory infections presents with a 3-day history of ear pain, fever, and difficulty hearing in her left ear. On exam, her tympanic membrane is red, bulging, and has visible fluid behind it. She is allergic to penicillin. What is the first line treatment for this patient? Is it A, azithromycin, B, cefdinir, C, amoxicillin and clavulanic acid, or D, ciprofloxacin drops? Take a moment and tell me what you got. So here, the stem of the question is, she is allergic to penicillin. What is the first line treatment for this patient? All right. So treatment, again, we need to look for a diagnosis. This patient here, same thing. We're thinking acute otitis media, right? Tympanic membrane is red, bulging, and has visible fluid, right? We know that we will go amoxicillin first line, augmentin second line, but this patient has a penicillin allergy. So we know that C is augmentin, so we can eliminate that, right? So when I tell y'all, think about the A's, amoxicillin, augmentin, both have a penicillin component we can't do. Third line is your azithromycin, your other A, right? So you want to go with A, azithromycin. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio. Click that link in the description. That is the best way to get the discounted prices for the holiday season right now, if you're looking for any of the resources that I do offer. And as always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.